Hi, everyone. I'm Maggie McGrath with Forbes Breaking News. Thousands of protesters have taken to the streets of India following the rape and murder of a female doctor in Kolkata. Here to explain more about the situation and why we need to understand the gender and political landscape in India's society is Surupa Gupta. She is a professor and program director at the University of Mary Washington, where she specializes in gender studies and comparative politics of South Asia. Professor, thank you so much for joining us.
Thank you for having me.
So let's start at the very beginning here. We know that this female doctor trainee was allegedly raped and murdered. What happened? What more do we know about her case?
Well, after her body was discovered, initially the police called it a suicide, despite there being injuries on the body that somebody would not associate with a suicide. Immediately afterwards, one person was arrested very quickly, but there have been allegations that the injuries and other circumstances indicate that multiple people were involved. Following that, the principal of the medical college to which she belonged was transferred, but immediately reappointed at another medical college, government-run medical college in Kolkata. In view of police's initial actions, the Calcutta High Court asked the Central Bureau of Investigations to run the inquiry to make sure that there wouldn't be any influencing of the police by local authorities or other stakeholders in the city. Following all of this, there have been massive protests in Kolkata. They started close to midnight on 15th of August, which is significant because India gained independence on 15th August from British rule, in 1947. So it was planned as sort of an measure to gain independence for women to be outside, to take back the night. The government, the local government, the state government in West Bengal, which Kolkata is the capital city of, has both responded, but has at times been caught flat-footed. So this is essentially what we know about this incident.
So you said the protesters very carefully chose Independence Day to start their protests. Are they protesting on behalf of all women and rape cases in India? Are they protesting to get laws changed? What are their motivations and what are they looking for?
So there are two different strands of protests here. So, of course, the main protest is against, first of all, get justice for the victim. That is the primary goal of, and demand of the protesters. But in general, the demand is safer working conditions for women. But there is a second thing that I would like to highlight, that there should be safer working conditions for doctors who have increasingly faced violence in their workplace, not only in West Bengal or in Kolkata specifically, but all over India. So this is a protest that has resonated with populations across the country, and there have been protests everywhere in the country, both because the violence was against a woman and also because the violence was against a medical professional. And of course, finally, there is also the demand that some laws should be changed.
I was going to ask you about that divide because in the news coverage I've seen references to hospitals being overcrowded, both public and private hospitals, which feels unsafe for doctors. And yet there was also a 2022 report indicating that some 90 rapes were reported every day in India. So how much of this is an issue of gender violence versus medical professional safety? I guess it's both.
It is both. Well, the 90 rape cases number, I did a little bit of math, and I think that comes from the most recent statistics available, which is 31,000 rape cases were reported in 2022 nationally. And that kind of comes to 85 cases, but I guess rounding off to 90 rapes a day comes from that statistic. High likely this is a very conservative number since a lot of rapes do not get reported. I was also looking at rape statistics in other countries, and say Brazil, which has a seventh of population compared to that of India, reported over 200 rape cases a day, and 83,000 cases in total, I think, last year. So it is highly likely that the numbers are that rapes go unreported in India.
As we look at this case, you mentioned comparatively with Brazil, but let's compare to the US. What rights do Indian women have that American women do not, or perhaps vice versa, that contribute to this environment?
Well, in terms of rights, I think women have rights in both countries. I can't say that I'm an expert on the exact legal framework that guides women's conditions in both countries. But in general, there are laws in the books for conviction and punishment against perpetrators. However, it is mostly an issue of societal norms, I think, and societal norms in both countries are problematic. We have seen, similar kinds of complaints as in both countries, that rapes don't get reported because the victim gets blamed, the victim gets laughed off. Perhaps there has been more of awareness creation and more training in the US recently. Again, looking at conviction rates, I found that there was a big difference, that conviction rates in the US in recent years have been closer to 70%, whereas rape conviction rates in India are around 27-28%. So really only a third of the convicted of those who get convicted or rather are accused get convicted in India. So I think it's a matter of norms rather than the legal framework. There might be fine print in legal framework that I'm not aware of, but there is definitely a differential in terms of norms. Although I would like to highlight that I think we know that violence against women is not unknown at all in the U.S. And there are similar kinds of accusations against women that come up when these cases of violence get reported.
Of course, we see, unfortunately, gender-based violence around the world. As you look at the gender norms in Indian society in particular, are there aspects of those norms that contribute to this situation where only 30% or so of these cases are getting convicted, where women are feeling unsafe? I was watching one news report where one woman was saying, I don't feel safe. I'm an Indian citizen and I don't feel safe walking home alone at night. And obviously we hear that in other countries. I want to be very clear, but what does the American audience need to understand about gender norms in India as they listen to these news stories and some of these personal anecdotes?
Well, it is the same kind of patriarchal norms that kind of guide societies all over the world. For example, there is a sense that boys will be boys, women need to be the ones who don't stay outside, which is something these protests have been about, that women should be able to be everywhere that they need to be, whether it's for work or for pleasure. But there is this implicit norm that women need to be at home. If they're outside at times when they're not supposed to be outside, then the blame falls on them. I mean, particularly in this case, the principal that I alluded earlier blamed this young doctor for being in a room in the middle of the night. And those are the kinds of norms we're talking about. And this is the head of the institution who said this and was transferred, not fired immediately, but I mean, he was fired from this job, but transferred to another similar job. And those are the kinds of norms I'm referring to here.
Interesting. So we've seen other rape cases take hold of the media and get a lot of attention. Why is this one sparking so many people to protest in the streets? What makes this case different, if anything at all?
Well, I think it's three things. One is safety of women, which has been an issue for a long time and is an issue in all cases of rape and all kinds of violence against women. But this one is combined with rape against a medical professional. Most importantly, this medical professional was actually doing her job. She was on night shift in that hospital that particular night. So she was doing her job. She was where she's supposed to be. It's not like she was outside somewhere. Not that I'm saying that she should not be, should not have been able to be there, or others should not be able to be outside at that time. But she was actually in the hospital, in a government hospital, which is attached to a medical school. And so that has resonated with a wider group of people, and it has created wider support. A third issue, beyond these two safety issues, I think a third issue that is coming up as a result of people finding out more about these some of these medical schools is a certain level of corruption that has permeated these schools, and that has created a particularly strong response to this case. While at the very basic level, the issue of violence against women, in every case should create the same level of outrage.
Now, Surupa, before we started recording, we were talking about the government response to the protest and to this young woman's murder. And you mentioned that this is taking place in one of the few districts that has a female minister. Let's talk about the local government response first. How is that minister responding, and does her gender play into that response at all?
Sure. So the chief minister, that is the state level head of that particular province in India, the chief minister of West Bengal, Mamata Banerjee, is one of the few, at this moment, possibly the only female chief minister in India. And she has a very large group of female legislators at the state level, which makes this a special case because in general, we know all over the world, again, we have disparities. Even in the US, we have disparities in the number of lawmakers who happen to be women. both at the state and at the federal levels. So that makes this really special. The chief minister in the past has been known to make comments such as, "Oh, this is part of a when women have complained about rape, she has been known to make comments such as, 'Oh, this is part of a conspiracy against the government,' or what was she doing out so late at night," kind of things. But in this case, she immediately asked for justice. She asked for punishment. She perhaps went a little overboard, saying that, we need to find the perpetrators and hang them as soon as possible. Well, India has is under the rule of law. That's not perhaps the most obvious response, but she has made the right noises. But at the same time, the government has been caught flat-footed at times, particularly the police response that I alluded to earlier, but also more recently, in fact, last night, the state government officials met and were trying to come up with a set of responses of what needs to be done. And one of the recommendations was that women should be assigned to fewer night shifts in any jobs. And this created, as expected, a second set of outrage, because a lot of women can only find jobs at those times, or those are convenient times for them to go out and work. This does not really further women's equality in any way. So, as I said, in this particular case, the government has been found to be caught flat-footed, not really coming up with the best response.
And what about Prime Minister Modi? Has he commented on the situation, or is he doing anything to address the protesters' demands?
Well, again, two things. The Prime Minister addressed this as part of his Independence Day address, and he asked that he said that we all need to take this seriously, this as in atrocities against women, that the country, society, and state governments will have to take this seriously, that there needs to be speedy investigations into crimes against women and strictest of punishments. But at the same time, the central government, or the federal government in India, has also said that the demand for stricter laws against violence perpetrated against medical professionals or health professionals is kind of a no-starter. There was something that was a piece of legislation that was recommended in 2019. I think that law did not go anywhere. The idea was that there would be stricter punishments and immediate actions against those who perpetrate violence against medical professionals. The central government said that, there are already adequate laws in the books. There is no need for an extra law. So that's where the central government has stood so far.
What, in your view, will it take to bring greater equality to India's laws, to society's treatment of women?
Well, first of all, I think what India needs at the moment is much more training of personnel at all levels. I mean, we know that training of personnel can lead to higher confidence among women to go and report a rape, for example. If when you go to report a rape, you're laughed off, then you're much less likely to even go and report it. So training of personnel at every level, whether it is the police, local health workers, and others, that kind of sensitization that when women come to report these kinds of incidents of violence, that they need to be taken seriously. That's one. The second thing that some lawyers have pointed out to is that the conviction rates in India are low because the judges have less discretion in terms of how much, or the severity of punishment that they can assign to a particular crime. So unless they are absolutely sure, they are less likely to send somebody to life in prison, to prison for life rather. They are less likely to assign the death penalty, which is a possibility when the crime is against a minor. So those kinds of things possibly have an impact on the conviction rate. So perhaps more discretion and training at the same time, because the judges are also products of the same society, and therefore need to be gender-based violence, need to be trained on and made more aware of the implications of gender-based violence and why women don't report, or what happens when they do report, and what kinds of problems women face in the entire judicial process. So those are two things I would like to highlight. And in general, of course, norms regarding gender roles need to change, but this is a tall task in every society. This takes a very long time. And there is a certain level of awareness about this, but there is also as I said before, because of traditional values and traditional attitudes, there is also this notion that, women need to take care of their safety, and they need to be in places where they won't be subject to violence. But we know that violence against women is not something that is associated with spaces outside the home, right? So the attitudes need to change so that violence against women is something that is addressed both by and within the home.
It strikes me that we are talking about the alleged rape and murder of a doctor, someone who has a bit higher socioeconomic standing generally in society than other women, at least in the US. Doctors, after they get out of residency, start making a premium salary. Does the socioeconomic standing of a woman who either reports a rape or sees her case get a conviction, does that affect the outcome in India?
That definitely makes a difference. In this case, she was still a resident, but that we are hearing so much about the case itself shows that, her being a doctor has a lot to do with the protests that we are seeing, that, she was part of a class, although she came from very simple background, very modest background, but she studied to become a doctor, and that has the fact that someone in her position faced such insecurity from violence against women has resonated with people. So yes, when the vast majority of violence that doesn't get reported perhaps happens at socioeconomic levels that are lower than, say, doctors and other professionals, that has certainly something to do with it. But even, I would say that even among professionals, there is the stigma attached to reporting violence that is, again, fairly widespread everywhere. So that hasn't completely gone away.
Now, of course, throughout this conversation, we have referred to the victim as a doctor and not by name. Has her name been released? Because I know that in American society, when there's violence against a woman, there's often a movement to say her name, to create a very personal look at the person at the center of the story. So she is not a nameless, faceless victim, but a person who has a life that was cut short. Is that a cultural difference, or is that just something that the family has chosen not to release her name?
There is a legal requirement that you don't say the name in India. So the name, I have seen names floating on social media, but there is also an equal number of posts that say that, you should not name the victim because that goes against the law. So traditionally, what has started to happen in say the last 10, 15 years is that the victim is assigned a name. They're not called by their actual name, but they're assigned a name. So
interesting. So what happens next? The protests began on August 15th, Independence Day for India. Protesters they maintained those protests. How long do you think it will go, and how long will they stay in the streets?
Well, that is hard to predict. The protests in West Bengal's adjacent Bangladesh went on long enough for the Prime Minister of Bangladesh to be removed from power. And I'm not suggesting that I see a parallel here, but I'm saying that whether there's going to be a sustained level of protest depends on how organized the protesters are. In this case, I think the fact that doctors are behind these protests could have a lot to do with, and the fact that this is a case of violence against a doctor could have something to do with the length of protest and the sustainability of protest. At the same time, I think what is also going to happen is that because the doctors, particularly young doctors, have refused to see non-emergency cases in the last few days, that is going to have an impact on popular mood, because in part of the reason why India has so much violence against doctors is because there are few doctors relative to the population. Therefore, the conditions of being seen, the time that it takes to see a doctor is really long, and they don't get seen always in ways that they are the patients are satisfied. So the doctors also have to walk that fine line of not pushing the seize work part of this protest too long, so that the general population doesn't get alienated, but at the same time keep up sort of a steady pressure on the government to push the investigation, find the perpetrators, and bring the case to its logical conclusion.
I see. So just to clarify what you just said, we've been talking about protests, but these emergency medicine doctors are also on strike?
Yes. I think the doctors are treating emergency patients only, but in general, other patients are not being seen. So to give you a specific example, if a patient is in the hospital, there is a resident medical officer at the hospital who's sort of doing his or her rounds and just checking on patients. But at least for the last 4 days, specialists have not come in. Other doctors have not come into the hospital, right? So in general, there has been a state of strike. That was supposed to have changed from Monday, and I haven't seen reports yet. But that would, alienate the general population, which suffers from lack of medical facilities in the first place.
Fascinating. Well, we will be watching these ongoing developments. But in the meantime, Professor Surupa Gupta, thank you so much for joining us and giving us your insight.
Thank you so much for having me.